It's an uncomfortable topic, but something that affects 50% of men over 50 years old. And erectile dysfunction is not only an issue applicable to older generations, but it even affects younger men. This morning we have Dr. Koushik to give us some of the facts on ED. Good morning.
Good morning, Jenny. How are you?
I am well. So first, what is the prevalence of erectile dysfunction? I think it's something that nobody really wants to talk about, but it's definitely a big deal.
Right. Like you mentioned, it affects about 50% of men over the age of 50. So 1 out of 2 people. And I do see in my practice that men as early as 30 years of age, it can start in your early 30s. And I see people that are sexually functioning all the way into their 70s and 80s and have a problem when they're 90 years old. So, so it can affect anybody almost at any time.
So how does it even occur? How does somebody get erectile dysfunction? Is it more psychological or actually physical?
I think the psychological component should not be underestimated. I think it's a factor in all men that have erectile dysfunction to some extent. On top of that, we have some of the medications they may be on, diabetes, hypertension, coronary artery disease. All of those things can also cause erectile dysfunction as well.
What is the link between heart disease and erectile dysfunction? I know that if you're taking nitroglycerides, right? If you're taking those, they say kind of stay away from Viagra.
Right. Actually, the entire class, Viagra, Levitra, and Cialis, should not be taken in men that are taking nitrates. However, it isn't safe in men with cardiac disease. As long as you're cleared by your medical doctor, it is okay. But the other part of that question was heart disease and erectile dysfunction. There have been some landmark studies which now show that years before you developed heart disease or vascular disease that may lead to a stroke or other issues like that, you may actually manifest in erectile dysfunction. So this may be an early sign of bad news to come down the road.
What are we looking at right now in this graphic that we have up on the screen?
Right, so that's one of the blood vessels that's in the penis, and you can kind of see that's nice and open there. And we have another picture, I think, to follow that. And you can see what can happen with ED is that the small blood vessels in the penis can actually get clogged up by atherosclerotic type of deposits, the same thing that can cause heart disease or a heart attack in the heart. So that's why this is kind of an early signal for other disease.
That's very interesting. Quickly, I want to be able to address a topic that we were just discussing during weather, which is, you said this is a problem that not only men need to address, but a woman in the couple as well. Can you describe that for me?
Right, and in my practice, again, I really encourage the woman or the spouse to come in with the male that's in the relationship, because it's a couple's issue, and sometimes as women age, menopause can be an issue. Sometimes they need to concurrently visit with an OBGYN, see about estrogen supplementation, things like that. So I think when we treat as a couple, it's a couple's issue and not just the man or not just the women. And if we treat both, you get better outcomes altogether.
Thank you very much. Some great information. Thanks, Dr. Shaw. Appreciate it.